Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. And today's show is called Dr. Jeffrey Tauth, where's family DNA secrets behind heart disease. And trust me, it's juicier than your cousin's peach cobbler. What if I told you that your grandmother's heart attack at 65 wasn't just bad luck? It was a warning signal written in your DNA. Today we're uncovering how your family tree shapes your heart's destiny. And folks, this is going to blow your mind. Let me hit you with some cold, hard facts that'll make you want to call your relatives immediately. Family history accounts for 40 to 50% of your heart disease risk. Yeah, you heard that right, nearly half. If one of your parents had heart disease before age 55 for men or 65 for women, congratulations, your risk just doubled. I can't make this stuff up. Now, before you start panicking and thinking you're doomed because Uncle Bob keeled over at the barbecue, let me explain what's really happening here. It's not just one gene sitting there like some evil villain plotting your demise. It's how multiple genetic factors team up with your lifestyle choices. Think of it like a really complicated recipe. Your genes provide the ingredients, but you're still the chef deciding how to cook them. Your family history influences your heart health through inherited cholesterol patterns, blood pressure tendencies, and inflammation responses. It's like getting a hand-me-down outfit, except instead of bell-bottom jeans, you're inheriting the tendency for your liver to make too much cholesterol. Thanks, Dad. But here's where it gets really interesting, and maybe a little scary. Families don't just share genes, they share dinner tables, stress patterns, and exercise habits. You grew up learning that Sunday meant fried chicken, mashed potatoes with extra butter, and sitting on the couch watching football for 6 hours straight. Those high-sodium family recipes didn't just taste good, they programmed your taste preferences like software. Family stress patterns and coping mechanisms get passed down like heirlooms. If your parents dealt with stress by eating ice cream straight from the container, guess what you probably do when life gets tough? Yep, entirely true. The apple doesn't fall far from the tree, especially when that tree is planted in a garden of questionable lifestyle choices. But here's the good news that'll make you want to do a little happy dance. Learned behaviors can be unlearned. Your genes might load the gun, but lifestyle pulls the trigger and you control that finger. Let me tell you about Sarah, one of my patients who's become my poster child for rewriting family history. She came to see me at 35, scared out of her mind because her father died of a heart attack at 48. We ran some tests and discovered she inherited his high LDL cholesterol gene variant. Now, some people might have thrown in the towel right there, but not Sarah. Instead of accepting fate like it's a bad movie plot, she decided to change her entire family's food culture. She started meal prepping heart-healthy dinners, convinced her family to take walks after meals instead of collapsing on the couch, and gradually transformed their eating habits. 2 years later, her cholesterol dropped 40 points, and here's the kicker. Her kids now prefer grilled salmon over fried chicken. If that's not a miracle, I don't know what is. So what's your family history action plan? First, become the family detective. Map out 3 generations, parents, grandparents, siblings, and note the ages when heart problems started. Don't just settle for grandpa had a bad ticker. Get specific dates, ages, and types of heart problems. Next, share this family tree with your doctor for personalized screening schedules. If you've got a family history stronger than your grandmother's coffee, you need to start preventive measures 10 years earlier than typical recommendations. And if your family tree looks like a cardiac casualty list, maybe I should see you in the clinic. We need to talk. Remember, genetics loads the gun, but lifestyle pulls the trigger. You can't change your family history, but you can absolutely change your family's future history. Here's your homework for this week. And yes, I'm giving you homework like the demanding doctor I am. Call one family member and ask about heart health history you might not know about. Create a simple family heart health timeline to bring to your next doctor visit. Trust me, your future self will thank you, and your kids will definitely thank you. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.